Hi, I'm Burke McDonald with Schaumburg Heartbeat. You may have noticed, if you still read the papers like I do, there's ads out there for, we have an emergency room dedicated for seniors over at Alexian Brothers. I thought before we got to that point, it'd be interesting to look at some of the history of the Alexian Brothers. They've been involved in the medical field for many, many years. It goes way back to the Knights. So let's look at this brief overview of their history. The Alexian Brothers ministry began in the Middle Ages, as Europe slowly emerged from centuries of ignorance and superstition. They would tend the sick, feed the hungry, and bury the dead. These were dangerously unorthodox activities in the 12th century. Most people, out of fear, shunned the sick and dying, forcing them outside the city gates to survive on the throwaways from the more fortunate. The first written account of the brothers is dated 1259. Under Brother Dominic, the brothers' numbers grew and their work began to spread from Germany to the United States, England, Ireland, and then Belgium. Brother Bonaventure Thalen landed in the United States in 1866 and established the first Alexian Brothers Hospital for men and boys in a small house on Dearborn Street in Chicago. After a move to larger headquarters, the Great Fire of 1871 destroyed everything they had worked so hard for. Quick to rebuild on the same site, the city plans of a new elevated line forced them to move to yet another location on Belden Avenue. Alexian Brothers Hospital in Elk Grove Village was established in 1966. St. Alexis Hospital in Hoffman Estates was purchased from another hospital corporation and opened in 1999. Each of these facilities has grown on their campuses over the years. U.S. News & World Report has recently named both hospitals in the top 10 of hospitals in the Chicago area in Illinois. Okay, we're back down in the emergency room with a couple of the people that work here. One is Becky Barron, who is the clinical educator. You teach everybody?
Yes, I do.
Okay, and we're also here with Brandon Estes, and I love your title, Concierge.
It sounds good.
Your parents have to be proud of you with that title.
Absolutely.
That's absolutely, okay. Well, you know, it is sort of amazing to read that. I'm thinking, what can you do different? Just so that everybody realizes, I have worked in an emergency room. I was a crisis counselor many years ago over here. And this is a great place. The people here do work together. But what are some of the things? They say the lighting is a little bit more subdued, that people come in here nervous. And you don't have to be a senior to be nervous.
No, absolutely right.
So what are some of the things that you've done to?
Okay, what we've tried to do with the construction of the department is make it more comfortable. So where it be the colors, the lighting, it can be dimmed, there's can lights. It's more like home. So when you do come in, it's just a more friendly environment, not so clinical. The beds are new.
Yeah,
they
now
are
wait.
comfortable.
A bed's a bed, isn't it? I mean, how have you done?
I don't know about that.
Okay.
I mean, honestly, if you ask someone that's been laying in a bed for many hours,
Right.
I think they would have a different opinion. It can be
Okay.
very, very uncomfortable.
So what have you done to help with the bed situation here?
Well, they're new and they're made differently. They're more air mattresses, so they decrease pressure points while you're laying in bed, and they reduce the incidence of sliding down the bed while you're in the bed. And
That could be embarrassing.
Yeah, I guess it could be.
So I don't think we want to see that. Well, another thing is that, and I don't recall this back when I was here, but now the patient has control over, if they're able to. Obviously, there's certain
Correct.
medical conditions they're not, but they can control how the bed is positioned too, right?
Absolutely. So they're given a little bit more independence, where they can raise the head of the bed, they can raise the foot of the bed to their preference.
Okay. Now, in basically your job is, in your case, you are working with the senior population, right?
Correct.
Okay. And many times people are coming in here and they have family, and we're going to go talk to the senior services people also about a lot of the opportunities that are available at the hospital. But families really nervous coming in here. And are you able to help them also?
That's what I try to do. I try to make everybody more comfortable while they're here, and just make it a little easier to be here and let them know that there is someone here that's here for them and here to take care of any of their needs or any questions that they might have. I think one of the biggest things about being here is sometimes people kind of get left in the dark, and it's, you know, there's a lot going on, and you know, people don't get all the answers that they need about testing and things like that, and I try to provide answers for that, and then try to you know, just check on how everything's going, make sure that they're comfortable. Now,
the one thing, and you're a young lady, when I was working here quite a few years ago, and I'm sure they had a class, but one of the things that I'm really impressed with when I work down here is the cooperation among staff. The nurses talked with the doctors talked with the caseworkers. I mean, everybody was in the loop.
And yeah, I think that is probably more specific to emergency departments in general, where there is a spirit of collaboration and a true teamwork environment.
Right, and also working with the insurance company. Somebody's got to work with them to get permission to do all this stuff too, and you got to know what's going on.
Sure, and that's not necessarily in the nursing hands, but yes, case management, social service, absolutely do have to deal with the realm of insurance. And
when you're working with families, especially the siblings or whatever of a patient, what are some of their, I'm sure for one, it's panic time for them.
Right.
What are their major concerns?
Mostly they want to know what tests are being done. A lot of people want to know when they're going to be done, and when they're going to get out of here. So helping out with that, you know, some of the concerns, just if they're going to find out what's going on with their family member while they're here, and making sure that they are getting the attention that they need.
Now, some of you know, because we've done segments on this before, my mom lived to be 104. She just recently passed away. She's come in here through the ER. But let's say I live in Schaumburg, but my brother lives in Cleveland Heights, Ohio. And you have situations, for whatever reason, a patient is brought in here and doesn't have family. How do you deal with that?
A lot of the times we'll get with our social workers and caseworkers, and we are able to set somebody up with maybe temporary care until they're able to find something more permanent, or a family member is able to take care of it. We're able to have people admitted straight from here to a assisted living facility or independent living or skilled nursing, whichever, you know, is best for them. And it's just one of the things that we're able to do from here that's working out really well to get them taken care of until we can find a long-term
situation.
For them, yeah.
And for those of you, we're going to have another segment where we actually go to talk with the Senior Services Department, where they can offer this assistance to you even if you don't have somebody in the emergency room. We're going to be doing that a little later in the show. You know, one of the other things they feature here is a clock. I think even if you're not a senior, they have a big clock in the room is important.
Yes, I mean, relationship with time is a big deal. You need to, because you don't really have windows or sunlight, so it's very easy to lose yourself as far as time orientation, especially in the senior population. You can easily become confused.
Right. And talking about confusion, especially in the senior population, there are times when somebody comes in here and they really probably need some memory help, or they may have some dementia. You have monitors that you can get involved with the situation, so that if they decide to walk or to be somewhere where they don't belong, you're sort of monitoring them all the time.
Yes, I mean, the beds have alarms, so if they get up unsafely or even change position extremely in the bed, it will alarm.
Okay. So this is fairly new. Have you been pretty excited about how's the rollout been going?
You know what? It has been going really well. We're still under physical construction of our department, but I think the rollout went well. All of the staff went through education regarding the changes related to the senior population, specifically the care of a patient that's confused or altered. And we have some of the care changes we are trying to anticipate the needs once they go home. So we're doing different screening tools, we're making sure they can walk safely, and then the discharge process is a little bit different, meaning we want to sit with them and go through a specific checklist to make sure that all of their answers are, you know, they have answers to all their questions.
Brandon, I know that's up your neighborhood, and they actually give you a piece of paper to go home where they've explained everything to you, and you've gone through that with them once or twice before they leave here. But that's still, you get home and your family gets home and they said, oh, why didn't I ask this? Or why didn't they tell me this? Or, you know, what's this medication for? You actually call the patients as a follow-up to see if everything makes sense, right?
I do. That's one of the unique things that we do while we're here. One of the new things, and I think it's helped out greatly. You catch a lot of things that, you know, like you said, people don't think about while they're here in the emergency room, and they get home and then they go, oh yeah, I need, you know, maybe we do need help with this, and I make sure that they get their medications okay, that there's not any complications with their medications, and make sure that they did get to their follow-up visit. You know, a lot of people don't realize that that is important, that they do follow up with their doctor after they come here, and just make sure that they get that taken care of. And just make sure that they're doing okay, that nothing has changed, and that they're still getting around their house okay, and that they don't need to come back here.
Okay, I think the key here, and if you have anything else to add, we'll be sure to add it, but I think the key here is to realize when you're coming into the emergency room, it's a pretty tough situation, whether you're a senior, you know, middle-aged person or a family with a little child. It's a nerve-wracking day. That you're there to help and give them whatever assistance they need, no matter what the situation is. You know, one thing we didn't bring out that I think we ought to show is we got the bed here that we talked about, but you also have a couple other seating arrangements for the patient. Sure. That if a bed isn't comfortable, right?
Yes, there's some alternatives to just a traditional bed. We have a few pretty nice recliners. So they're full care recliners where you can actually receive your care in the recliner, and you know, have the IVs and all that, because some people's body habitus is not really set up for these types of beds, so they're more comfortable sitting up, whether it being, you know, they can't tolerate a laying position because of respiratory or whatever issues, but it's just another alternative that we have here.
Okay, well, I hope that people coming in here see the changes and feel that they're useful for them. We're going to move on. We're going to go over to the Senior Care and Resource Center, I think is the title of it. And we're going to talk to Nancy over there, and she's going to tell us really what are some of the things that you as a caregiver might want to be thinking about.
And I'm happy you're watching Schaumburg's Park District Cable Access TV, WSPD.
We're with Dr. Mark Gordon. He's one of the ER physicians down here. Now, I know that they're still in construction, and they've been making some changes, and that can be aggravating at times because things are changing. But to me, it looks pretty nice what's going on. How have you found the differences?
Yeah, the rooms are actually much nicer. They're a lot more comfortable for our patients. I think we've done a lot of things to improve safety, particularly for our seniors. So it's been very positive. Working through the construction's, of course, been a challenge, but,
right.
But we're getting toward the end of it. So we're pretty excited about how things are going.
I know from working here before that the staff has always been concerned about whether it's a young child, a middle-aged woman, or a senior, you know, that there's differences going on. But there's been more training toward the seniors situation now, and probably other training. Have you noticed a difference in the staff with all the training that's been going on?
Yeah, quite a bit of difference. I think the seniors, a lot of times people didn't really know how to deal with them, and I think we've created a lot more safety for our seniors. The training's really helped us understand some of the differences in their needs, and I think where it's really helped us is when people go home, we're able to provide resources we didn't have before, and in a lot of cases prevent unnecessary returns due to falls and medication problems. So you know, it's been very positive for all of us. Well,
I know you're busy out there. I hope an ambulance doesn't come in all day, but I know you're a busy man, and I really want to thank you for taking the time to talk with us.
Oh, you're very welcome.
We're over at the Senior and Community Resource Center at Alexian Brothers Medical Center. You might have noticed, I don't know, if you go in the pig parking lot when you go for your doctor's appointments, it's a real little building that's right next to it, and you say, what's that with the hospital? That's where we're at. And I think you're going to find there's a lot of great resources here. We're here with Nancy Freske. Did I pronounce that right?
That's right.
Okay. And she's the director over here. And it's amazing all the information that you get. I hope that we can get this covered within the time frame that we're allowed. But our editor is really good, so I'm sure we'll work it out. When we were just in the emergency room, and I know you were over there listening to that part of the taping, families are coming in, and it'd be nice if they were able to get all this information ahead of time, but I guess in reality, you wait for the moment like anybody. Mm-hmm. But you offer a lot of resources of caregiving. Mm-hmm. That's one thing that really concerns me, is it's really a nervous time for people. And how do they get the assistance? How do they figure out, you know, if I'm going for, I want services at my home, how do I figure out who to call? And how do I know if I'm getting somebody that's really legitimate and does a good job?
Well, first of all, when the ER was planning on creating the senior ER, they included my department in the conversation, so we were able to help them with some ideas on finding resources. One of the things that we have done here is place all of our resources on our intranet, and we showed the ER staff how to access those resources. And those resources can be anything from emergency alarms to in-home care to in-home housekeeping help, all those kinds of things that people don't anticipate that they might need once they're discharged from the ER. They also give them one of our folders which contain a business card, a newsletter, and it looks like this, as well as our brochure that explains the services that we provide to the community here at Alexian Brothers Medical Center. So if they go home and read this information and say, gee whiz, I need this or I need that, they know who to call.
All right, and in addition to that, even before an ER situation, if I'm at home and I have a relative that I'm a little concerned about, I notice one of your services is memory loss, is trying to evaluate. They can set up an appointment with you, and then you can say, yeah, maybe that's a good idea, and who to contact to get it done, right?
That's one of our most popular programs, is our memory loss screening. So we've partnered with our neuroscience department here at Alexian, and they provide for us a healthcare specialist that comes actually to this department several times a year to screen people for memory loss. As well as we provide this at our Health and Wellness Festival each fall. We also take our show on the road, and we'll go to, for example, the Arlington Heights Senior Center and have that healthcare professional there and meet with people.
You'll come to the Schaumburg Senior Center too, right? If they
absolutely, absolutely. But I just want to let people know that not only do they have to come here, but we're also out in the community.
Okay, and you have another service that you have that's somewhat tied in with that, but not necessarily the same, is you have a geriatric assessment program that sort of does an overall assessment too,
Correct.
Right?
So we can refer people to our older adult care department here at Alexian that's run by Dr. Roger Weiss, and his team does a full geriatric assessment on our seniors.
Dr. Weiss, if you've watched this show for a number of years, has been a guest on us a number of times, and he's an excellent resource. You know, it's really, as I said, it's sort of overwhelming. But once people come in and they start working with you, do you find families can somewhat at least calm down a little bit and say there's a resource, there's something that we're going to be able to get done?
Absolutely. One of the things that I have here that nobody else has here anywhere else is a great team who will meet with the clients, and if a person comes in for a particular need, we'll do a full assessment to see if there's anything else that these folks might be eligible for. For example, if they come in here for looking for a great Medicare Part D program now that it's open enrollment, if they're having difficulty paying for some of their medications, what we can do is a medication search to find out if there are resources out there that'll help them pay for their medication. So even though people come in here with one question, we'll do a full assessment and they'll walk out with as many resources as they're eligible for.
Another thing that you have, I notice, is, and this is done at different times throughout the year, you ask people to bring in all the medicines they're taking.
Correct.
All the medicines, bring them in and put them out here on the table.
Correct.
And somebody will sit down and say, wait a second, you're taking this medicine and this medicine, they're interacting with each other in a way that could be a problem.
Absolutely. So we have partnered up with our pharmacy department here at Alexian, and Bob is the pharmacist that comes here several times a year, and we take appointments for this, so people do come with all their medicines. And actually, he sits here in this office and he goes over those medications and provides information for the client that they may not know about with their meds. And there have been times that they've found some negative interactions between meds that the person can take back to their doctor and say, "Doctor, I just found out that this may not work for me because of this other med. Is there an alternative that can be prescribed for me?"
That sounds like a great program to me. I'm not sure when this is going to run, but whenever it runs, I'm sure it'll be within the time frame. We're going through insurance, it's like insurance chaos. We don't know what's going on, whether you're a senior or a regular person. But one of the things that a couple of things you do, you have a program specifically to help seniors to help find insurance, right? SHIP?
Correct. We are SHIP counselors here, so
we got to pronounce that carefully.
SHIP counselors, Senior Health Insurance Plan or Program. And so we help people find Medicare. The other thing that we're doing now, too, is all my team have been trained on the marketplace. We get about 50 calls a week regarding the marketplace. Some are very simple questions to, I tried to get in, it doesn't work, is that right? To, how can I fill out an application? What do I need? So we can coach a person through that process.
Now, we're going to go back again. We're plugging our own self here, but we did a segment on this before. You got the dot. This is a program that you'll give people information on or sit down and, again, advise them about it.
Correct.
You put this yellow sticker on your car, and then if the police pulls you over or you're in an accident, they know that you have medical information in your card.
Yes.
And that's useful for both the medical people that might meet you during the incident, and it's also something they can bring into the ER with them.
Absolutely. So we encourage people to fill out that yellow card that comes with the yellow dot, which contains their medical information and any other like medications that they're on, especially blood thinners, so that the paramedics or the first responders know how to care for that person based on the information that's on that card. And I also teach advanced directives out in the community, and when I do that, I tell people to put a copy of their advanced directives in their glove box with the yellow dot.
That's a good question. You get sick, or your mother, dad, or somebody that you're taking into the ER, or you're just going to the doctor with them, you have to have advanced directives so that if those questions need to be arised, and also aren't there programs that you need to even be able to talk to some people once you're out of the situation? Maybe in the emergency room you can probably sign it, but you need to sign forms to give permission for your doctor to talk to somebody besides you, right?
Correct. So advanced directives, what that means is if you're not able to talk for yourself, you have delegated to someone else that authority. And so on those papers is the name of the agent who can speak for you. And I'm very passionate about that, and I feel everybody should have advanced directives completed before coming to the hospital. But if you don't, we'll help you with them. And that's another thing people call us about all the time. Can you send us forms? Can we come in? Can you help me? And we're very, very happy to help people with this.
While we're asking questions, you have a program coming up in Ask the Nurse, where you will work with people. If they have medical questions, they'll have somebody available that they can ask those questions in a way that's non-threatening, and they can hopefully get an answer, at least to lead them to where they might get a more definitive answer if it's needed.
Absolutely. So we have, once a month we have a program called Ask the Nurse, and this month it actually has to do with heart disease. And so we have a speaker who's a subject matter expert speak about the subject, and then afterwards we either meet with them one-on-one, or they can write their questions down on an index card and hand them in at the end so they can still remain anonymous and have their questions answered in the group setting.
Now, we're taping in November, but I'm not sure whether this is going to run in December or January. Do you know what your December, January program is?
Off the top of my head, I haven't.
Okay.
I can't recall right now, but every month we're having a program.
Okay, and we can get that information and you put it up on the screen.
You can also get that information in our Reaching Out newsletter that we send out 3 times a year. So this edition is from September 1st until the end of December, and then we'll have a new one starting January 1st.
And in this, I've read through them, a number of them, because I think I get them in my house. They have a topic article, but they really go into some other issues that might be of interest, and you list all your programs in there for the next 2-3 months, right?
Correct, absolutely. We just finished an ARP Safe Drivers program yesterday. For 2 days, folks came in for a half a day to learn about safe driving through an educator from ARP, and that program fills up immediately. That's a very popular one.
Okay. And you can give us a site that we can have them either contact you by mail or the internet or a phone, right? And we can put that up. And now I know that we're zeroing in on seniors today, and that's a really important issue, and I'm really concerned about it. But another thing I noticed in the brochures here, and this wall gives, you know, if you think they don't have a lot, just look at this wall behind us. It's amazing all the different things that, you know, you think you don't think about them. All of a sudden you say, what, you know, I never thought about this issue. What do I get help on it? And you probably have a resource for it over here somewhere.
Absolutely.
But this is a big issue now, especially with the football season coming to an end. But parents are getting more and more concerned about convulsions and students and children in sports, and even older people when they're participating in some of these sports that they're supposedly having fun on. That's something that they might want to think about. And Alexian Brothers offers a service on evaluation, right?
Right. In our neuroscience department, they do concussion evaluations. I'm a nurse, so I can tell you that many years ago, people just didn't think that that was a very serious thing to have, but there have been multiple studies done to show that there can be lifelong effects from concussion. And so we're very, very happy to have our neuroscience department here providing those kinds of evaluations and provide education as well to prevent concussions.
Now, I know, and we've talked about it, and I don't think we can overemphasize the caregiving situation. You need to have some resources available to you. Many times it's going to be a sibling that's going to be the main caregiver, and there gets to be a time when sometimes it's really overwhelming for them. And you have a couple situations available. One is a respite service, right?
Right. We can refer people out for respite so that they can get a little break from caregiving.
Okay. And you also have counseling groups and other groups where caregivers can come in here. Don't you have a group once a month or so?
We do. We have once a month we have a caregiver support group that's run by 2 of my associates here, and it's in the evening. And people have found it to be very valuable. Yeah,
and I think it's good for you to come into this. If nothing else, you can hear what some of the needs that other people have that you hadn't even thought about, and also to learn that you're probably going through things fairly similar to what other people are going through at the time. And just that in itself is able to help you deal with it, right?
Absolutely. You know, I took over this department about 4 years ago, and one of the things that I have been striving to do ever since then is market the department and tell people the things that we're doing here at the Senior and Community Resource Center, because people didn't know we even existed. And if they did know we exist, they didn't know how much we can help them. And so people walk in with one need and realize that we can help them with other needs that they didn't even think that they had. So we're really happy to be here to help people.
And most of the time when these caregivers, especially if you're working with a senior, there comes a time when people pass on, and now you're dealing with bereavement issues, which again, even though you know it's coming, in some cases you don't know it's coming. Recently I've had some good friends die very suddenly of a heart attack or something. But you do offer also bereavement services to help people through it and to help people find the support they need. And if they're feeling any anxiety at all, it is a good idea to seek help.
Absolutely. I mean, we have our wonderful hospice home, and we have Cindy Wallace working there that runs a bereavement support group. We also have Alexian Brothers Parish Services that provides bereavement services as well. We've got grief support. There's many, many options for people to get that kind of support here at Alexian Brothers.
All right. And so if you feel comfortable working with your church or synagogue, whatever it is, you can tell them to contact the Alexian Brothers system, and they will work out the parish services. That's what that program's designed to do,
Absolutely, right? Absolutely,
absolutely. We just don't have enough time. We could probably spend 2 hours on this and still not have enough time to talk about all these individual programs that are available and what people should be doing. But I think, like you said, it is overwhelming. There's a lot of issues that we probably haven't even touched on. You can, if you don't deal with them, you can probably tell them where maybe is a good resource that they can go to get some assistance.
Absolutely.
Well, I appreciate your work. I appreciate all the work of the Alexian Brothers. We mentioned earlier that they have a long history of working with people in the medical area, and I encourage people to come over to the Senior Counseling Center and get some assistance. If you have any questions, Nancy and her staff are here to help you. They're very friendly. Sometimes they're very busy and you'll get an answering machine, but they will call you back. But that's what you're here for,
That's
right?
what we're here for.
Okay, I'm Burke McDonald with Schaumburg Heartbeat. Hope to see you again soon.